Ireland, statistically, 1 in 3 people will develop cancer at some point in their lifetime. Lung cancer is the most common. Following that is prostate and bowel cancer for men in this country. Surgery, radiotherapy and chemotherapy are the most common treatments for cancer. However, due to earlier detection and better treatments, survival rates are on the increase. How many times do you go to the doctor a year to get a checkup from top to toe?
Not many, probably 0.
And why is that? Why don't you go and get yourself checked out?
I don't really feel the need to, but sometimes I get a scare.
When was the last time you were actually at the doctor?
Oh, I'd say more than a year ago now at this stage, yeah.
Well, there are symptoms when a man develops prostate cancer. Unfortunately, those symptoms really don't occur early enough. The symptoms in question might be pressure on the waterworks, so it's difficult to urinate. He gets up a lot at night. He dribbles and leaks. It doesn't always cause those symptoms early enough. And so the best way to pick up prostate cancer early is to do a blood test called a PSA. And it is a chemical which is detectable in the bloodstream and can show that the cancer is present before the patient will develop any symptoms. And of course, then you get to diagnose the cancer that little bit earlier.
Why do you think Irish men aren't interested in getting themselves checked out, or is it just a general thing?
I think it is just a general thing. A lot of them just don't bother going to the doctors for some reason. They think they're healthy, and I suppose it's a false preconception they may have, you know.
The early symptoms and signs of bowel cancer would include a significant alteration in bowel habit. So not, for instance, if you go out to a Chinese restaurant and you get diarrhea the next day, but if you have a persistent problem with the way your bowel is performing, for instance, sometimes constipated, sometimes diarrhea, or if you have rectal bleeding, or if a person just feels generally unwell.
Well, I was always a person that kept myself healthy and fit, but I often wonder what I was like inside. And a friend of mine, there's a doctor, said you should go and get a checkup. But like most men, I didn't bother. Until one day I was in the bathroom and I noticed a small little bit of blood on the tissue. And I said nothing to anybody for about a week. So in the gym I asked some of the lads, did they ever get anything like that? And they said it's probably piles. So I said I never suffer from piles. So I went to the doctor and he sent me down to see a specialist in the Adelaide Hospital. And they decided to do a colonoscopy on me, and they discovered polyps, and I was operated on. And I had a temporary ileostomy, which was reversed 3 months later. And I went for my regular checkups on a monthly basis to the professor, and after 1 year I was unfortunate enough that the cancer came back at the same spot. And they found a small tumour the size of the nail on my thumb. After the operation I was left with a permanent colostomy. I then had my check-up with the surgeon, and he suggested that I would have chemotherapy and radiotherapy this time. That all ended on the 17th of April 2003, and since then I've been getting 3 monthly checkups. But last July I got good news that I don't have to go back now for 6 months. Well, I would advise them if there's any symptoms or any history in the family of disease, they should go and have themselves checked up, particularly men that are not really, they don't seem to really go to the doctor as much as women do, because the earlier you go, the better for yourself. Now I find like I'm in great form, I can play with my grandchildren, I run, so I'm one of the lucky ones.
The Irish Cancer Society has a broad range of patient care options for people who are diagnosed with cancer. The Cancer Information Service is for those affected or concerned about any issue relating to cancer. It can be accessed via the National Cancer Helpline, which would be the mainstay of the service. And people would often phone about any queries, from maybe they're concerned about their risk of cancer, to inquiring about signs and symptoms of early stage cancer, to asking what to do if they have a symptom of cancer, to those who are diagnosed and perhaps want to talk a little bit more about what happens next, what treatment options there are, what are the side effects of treatment. We get a lot of calls about people who are looking for further support, be it in the community after their diagnosis, be it what's available within the hospital that they may not have heard about, be it counselling, psychological support. help at home for people who are diagnosed with cancer. So it's a broad range of services. As well as the information on our website and the interactive help online, we have a live link to one of the Cancer Information Services nurses. We have a cancer forum for people who might want to get support from other cancer sufferers, again via our website. We also have 25 publications in our Understanding Cancer series. For example, Understanding Prostate Cancer, Understanding Lung Cancer. They're just examples of specific cancer sites that we have. But as I say, we have 25 of them. And we also have booklets on chemotherapy, radiotherapy, on psychological support, how to talk to somebody with cancer. And again, these can be accessed via our National Cancer Helpline. We opened a prostate cancer information service in April of this year. That's obviously for men affected or concerned about prostate cancer. And we've had a huge response to this because men's health is very much an issue for the Irish Cancer Society. And we've been working on this quite a lot in the last number of years. 3 years ago we had our first Men's Cancer Awareness Week, and the response to that was absolutely phenomenal at the time as well. I mean, traditionally women have been very quick at coming forward to ask for help, but men haven't been as quick. We see in Ireland on average about 1,400 cases of prostate cancer per year. I mean, this is projected to increase. Certainly people are surviving cancer these days, and the statistics show that a lot more people are surviving cancer, but you often hear the bad stories as opposed to the survivors out there. I mean, we have our cancer support groups in the Irish Cancer Society, and these are volunteers who have survived cancer, who join a support group and get trained up in order to help other people who've been diagnosed with cancers.